Welcome back. This is MTP number 61. And we've had a little time off over the holidays, and I'm absolutely blessed to have with me today Dr. Ashley Tapscott. She is the founder and director of the Sexual Health Institute of the Carolinas. She's also my very good friend and one of the top 3 female implanters in the world. And we've been working together for what? Over 10 years.
Absolutely.
Over 10 years. So she's going to help me out with today with the question that was spurred on by a guy named Adam who had an implant done in Turkey. And what we're going to talk about today is, things that might occur after surgery when it comes to the way you urinate after a penile implant. But the first case scenario, which is not you, Adam, that would be the patient who's had a prostatectomy and he's got a little bit of leakage and he's about to get an implant. How do you counsel them, Ashley?
Well, I think certainly we know that post-prostatectomy patients certainly can have some level of stress incontinence due to the nature of the prostatectomy itself, no matter who your surgeon is, your oncologic surgeon is. So I first of all counsel them to make sure that they know that placing a penile implant may help them actually kind of put that urethra together, put a little bit of compression on that urethra. Sometimes we tell them, maybe a pump or 2 left in the cylinders, or we call it walking around with a little bit of pocket change, may kind of push that urethra together. And the other thing that these gentlemen and their partners need to remember is once you get your confidence restored, once we kind of put your life back together after this prostatectomy, you get a little sassy and you can start to do things. You get a little more activity. Maybe you get back to the gym. You start to be a little more intimate with your partner, certainly. And so restoring that confidence may make you more active, and certainly losing weight, getting you on some testosterone if you need that. All of those things will kind of help the blood supply and some of the compression in that area, and certainly in terms of having an implant.
So, Ashley, the global effect of having an implant in a patient who's had a prostatectomy and has a little bit of leakage oftentimes leads to being dry.
Absolutely. Oftentimes leads to being dry. And again, certainly understand there are several factors as urologists that we talk to men and women about when it comes to incontinence. Things like, your pelvic floor health, the strength of your pelvic muscles, weight loss or weight management. So understand that we can also, as urologists in our urology background, instead of just implant specialists, counsel you on that behavior as well.
Now I know why you call your place chic. All right, so Adam, to address your question that got us to this, which is you're only 37 years old, you never had any prostate surgery, but you're talking about having some post-voiding dribbling. After you pee, you'll dribble a little bit, and it's kind of based on the same physiology in that there's this compressive effect of the implant that will hold back a little bit of urine, just a few drops of it. And that happens to everybody, Adam. And some guys actually have to reach down and sort of express those last few drops out, or you can just leave it, like you said, with a little bit of pocket change, and it'll end up not dribbling out after the fact. So it is something that does occur normally with the penile implant. There was nothing wrong with that part of your procedure, Adam. So just reach down there, give it that last little squeeze, and you should be able to get the last few drops out so it doesn't land in your underwear or in your bed, which is what you were contacting us to complain about. So, Adam, I hope things get better. Ashley, it's Dr. Tapscott. It's always an honor to have you around. And we will see you for 62 very soon. Bye.